have to check to see what that number looked like last. Looks like we were hoping to see 17 participants at the noon hour. We're at 14, and that number was inclusive of those that were our guest speakers. So I think in the interest of time, we can go ahead and get started, given the format that it's kind of a Q&A, free-flowing conversation. The hope would be if people join us late, they can still jump in and benefit. And just to let everyone know, the meeting is being recorded for those who are unable to attend either this noon session or our 5 o'clock evening session, so people can revisit the topic and benefit from the discussion that we have. With that in mind, it's a small group. Everyone has the ability to unmute themselves, so please take both responsibility as well as independence in that. If you have something to say, if you like, I think you can raise your hand using a reaction icon if you want to give a speaker notification that you would like to interject with a question, so they're not interrupted in their train of thought. We'll also be monitoring the chat. So if you're shy and you don't want to unmute your microphone and you feel more comfortable typing a question out, I'll pause periodically and make any chat comments known. As this is being recorded, I don't know that the chat features are being recorded, so I will verbally read those questions and comments so that subsequent viewers can have the benefit of hearing what's discussed and typed in chat. I don't think there are any more housekeeping logistics we need to cover. Some familiar faces. The flyer that invited you here expressed preference that you would have completed the hour-and-a-half SDP orientation offered in the Regional Center's learning management system. I haven't heard anyone to this point say that they've had any difficulty completing that, but just a reminder that that information is available for self-paced learning online. And with that, I'll do some introductions of our in-house staff. We have with us today Tracy Brown, one of our 3 associate directors. We're also joined by Rebecca Johnson and Hannah Dunham, 2 client service managers. And we also have our special guest speakers who come to us with vast experience in the world of financial management services, the one and only Regional Center funded POS, the one and only vendored service that SDP participants are required to have to participate in the self-determination program. So we have with us John Whitman with Emlyn Billpayer, Joe Hernandez with Aviana, and Jason Berquist with Mainsel. And we'll be listening to them speak about some of the different models of the FMS service delivery. And if you've seen the SDP orientation, which we all hope you have, hopefully you're somewhat familiar with the concept that there are 3 different models in which services can be funded and an associated cost with each of those 3 different models. So with that, I can turn it over to Tracy for maybe an overview of what the time frame, how we'll schedule the discussion today will look like.
Great, thank you. Thanks, Herman. And thanks everybody for being here and coming today to listen to the information, whether you've heard it before or just getting a refresher. I know it's a lot to take in and it's a lot to learn, so we appreciate you coming and bringing your questions and answers. hopefully our answers. So we kind of have laid it out. We'll start out with, let's see, sorry, I'm looking for my email that I sent. I can't remember. I know that John was going to speak first in regards to there's 3 different models. And so John was going to speak first, and I guess I'll kind of leave it to you, John, to take it away and talk a little bit about the FMS model.
Okay, thank you very much. First of all, thank you for the invitation to be on the panel today. It's a great honor. We greatly appreciate it. My name is John Whiteman. I'm the president of the Emlyn Group, and we're headquartered in San Diego. We're a California-based FMS, woman-owned business, and we've been doing FMS work for a little over 20 years. The interesting part about it is that when we first started back in the self-determination pilot program days, we were approached by DDS to become an FMS for Tri-Counties Regional Center and Eastern Los Angeles Regional Center as part of the self-determination pilot program. So we've been at this business for quite a while. FMS is our only business. It's not a sideline. But anyway, I was asked to speak today first about there's 3 models that was referred to earlier. We're speaking today to the service code 315, which is the bill payer model. The bill payer model is really very, very interesting. It's sometimes called the fiscal agent model. A participant who may choose this model as far as an FMS provider, this is when goods or services are purchased from a business, and the FMS is providing services in this capacity, writes checks and pays for the goods and services that are listed in the spending plan. And it's understood by everyone that the spending plan may from time to time be modified. So that's important to remember if you're a participant in this program. The other really important thing on the bill payer model is the fact that there's no employer or employee relationship that exists between the FMS provider, or the participant, or anyone who provides services. So that's important to remember. There's no employer-employee relationship. Now, the interesting part is when part of self-determination, this is a really, really good part about it, is that the participant has so much control over what happens. So upon approval, for example, by the participant, the business provides that the business that the participant has contracted with provides services or invoices. Upon participants' approval, they provide those invoices to the FMS provider, usually on a once or twice monthly basis, in order to coordinate with the regional center reimbursement system. So what we do in our accounting department is we contact, for example, each of the businesses or services that the participant has selected, and we contact them to organize how they will invoice and where they will invoice and how the payment schedules will work. So that's very, very important to have happen because we want nice, smooth transition. But that's part of what the bill payer model is all about. Now, once again, when the participant approves the invoices we write the checks, and we'll coordinate this effort with the participant. The other important thing is that anytime that any UCI number is used or anything that identifies the participant in our communication with anyone, we always encrypt it, and that's for privacy purposes. So that's important to remember. Also, that it's important for the participant to remember that the business that they're furnishing services or goods and services to the participant, that business maintains the employer-employee relationship and with any workers, and therefore that business or service is responsible to abide by all the applicable laws and taxes and to obtain appropriate insurance in terms of workers' compensation insurance and also professional liability and general liability insurance. The other part of it is that in the bill payer model, and I'm sure the other speakers will speak to this too, in the bill payer model, what our accounting department does is on a monthly basis, we furnish a report to the participant and their service coordinator. And that report is this, is that here's your spending plan money that in the beginning of the month, here's where we started, here's what was spent during the month, and here's what's left over at the end of the month. Therefore, our accounting department and the participant and that individual's service coordinator were all on the same page because they get a monthly report. And that's extremely important to note also. The other thing, again, I want to reiterate, there's no employer-employee relationship, and that we pay the bills approved by the participant. There may be some questions on that. The rate schedule that we follow, that was talked about a little bit earlier, the rate schedule we follow is a rate schedule that's published by DDS, and that's available online, or if someone wants specific information, I'd be happy to share that. It's public information. And that's kind of, I sort of kicking things off, that's kind of where we are.
Thank you, John. I appreciate that quick kind of an overview of the bill payer model. I think we'll go through all three models and then we'll have questions at the end. Next will be Joe Hernandez from Aviana, and he's going to share with us a little bit about the co-employer model.
Thank you, Tracy. And I did have a PowerPoint. Do I have the ability to share? We like our visuals too sometimes.
Definitely.
That would be
Thanks, Joe. I'll set you up with that. Give me 1 second. All right, you should see now on your computer the icon to
Perfect.
share your screen.
All right, so welcome everyone. Good afternoon. It is afternoon now, lunchtime. I am Joe Hernandez. I'm Director of Client Relations with Aviana. We are an FMS. We'll give a little more information about us later in the presentation, but first wanted to address the co-employer overview as requested for today in regards to the self-determination program. I have to thank John for already addressing some of the beginnings of the FMS discussion and talking about the bill payer model. Our next slide kind of shows the responsibilities of an FMS in general, regardless of what model you pay. You know, your FMS is a required part, as John said. They are going to pay out your program through the spending plan that is developed with the regional center and yourself. And it is a vendored. We are vendored, so we go through that extensive process of being vendored by the regional center as well. All FMSs are going to support with that spending plan. John talked about the monthly report that is given out. They're going to be helping you pay for your services through the spending plan only. They cannot allocate any funds to anything that is not on the spending plan. And then also we're going to make sure that any background checks or qualifications that need to be done for any services, if you're, even if you're using bill payer model, you might be going to a therapist, there needs to be that verification that that therapist is licensed and current. So again, the three models, I'm just flying through this part because John already approached it. We have the bill payer, the sole employer, and then the co-employer. Bill payer, again, is your do not employ anyone. That is the main question when you're looking at your models. Am I going to employ any people personally in this program, either through a sole employer model or a co-employer model? And we're going to address the co-employer model right here in the next slide. So co-employer, we do want to employ people for our program. So maybe John wants to hire his neighbor to help him learn cooking skills. Maybe that's part of his IPP, and that's something that is funded through the spending plan. So he wants to personally hire his neighbor. That would be an option where you would say, okay, I need to hire someone. So I could either use a sole employer model, which we'll go over later in this presentation or in the next presentation. And then, or you can use a co-employer model, which co-employer is something that is already exists in our system. We see it in respite a lot. There's the EOR or FMS respite that exists in the system, traditional system, where this model is used, where the family decides who they want to hire to provide the service. And then they share the responsibility with the FMS. So the FMS in this model is responsible for making sure that all employment laws are required. They actually supply that workers' comp, that liability that John was talking about, are supplied by the FMS. They handle all the necessary insurances and employment related needs. Again, we will have policies in place to make sure that laws are being obeyed. Mostly the concern is that making sure that we're following all employment law. So there will be policies in place that the FMS has that the families or the clients will sign off on that agreement. We're also still going to do that background check, make sure that qualifications are good, that the care provider, if you're choosing to hire someone, is fit to actually provide the service. And also we're going to bill for any services that are needed. Something that is important to know about the co-employer model and the sole employer model is that the bill payer function is folded into that model. So even if you are using an outside agency or entity where you're not necessarily needing to hire your own care provider or person or individual to provide a service, you would still have that ability to pay for an agency's service through your co-employer model or your sole employer model. So it's folded in. And so breaching that means that, say, if a program happens and you're using an agency, say you're really happy with your SLS program that you're using in traditional services and you still want to use them in self-determination, then you could do that. You could stay with that actual agency, and that would be a bill payer function that the FMS would perform, and they would be paying that agency directly, cutting a check monthly or on whatever pay schedule is required for that agency. But then also that other scenario, say we wanted to hire that neighbor to help with learning some cooking skills for part of an IPP program, then also you're deciding you want to hire someone personally. So you are actually doing two functions of the FMS in these models. So whenever that happens, you always will defer to the model that allows you to hire someone personally. So that could depend on which way you want to go, if you want to go co-employer or sole employer, but you're always going to defer to one of the FMS models that allows for employment when you are in that in-between, where you're utilizing an agency that already exists and just needing to pay them monthly, and you don't need to hire anyone for that service. But you also are doing a function where you are hiring someone directly to provide a service as well. So you're always deferring to the model that allows for the employment function. Like we already covered this, where basically the main question is, do you want to hire someone or not? That's going to lead you to kind of help you whittle down which model you will use. And then what do you want that relationship to look like will be the differentiation between sole employer and co-employer. For co-employer, again, we show that you're sharing that responsibility of employment. So there's those policies in place that the FMS has to make sure that you're in alignment with employment law. And then also you're piggybacking and using the FMS's already established workers' comp and liabilities, insurances and such, so that you won't have to go out to market and actually establish your own plan with those services or with those insurances and such. Something to remember too is, and also that I know and I'm aware of, is that FMSs out there who do the sole employer will help you find usually that insurance, that additional workers' comp and whatnot. Those are always good questions to ask your FMS when you're shopping around for an FMS. You know, what resources do you have? You know, what exactly can you help me with? And what kind of knowledge do you have in breadth background in providing financial management services? And again, so now we talked about cost, and John kind of breached on cost of an FMS. So just wanted to show this real quick for everyone. FMS cost differentiation is determined by the number of service you have and also the model that you choose. So this is the chart that DDS did provide. This is the monthly maximums that an FMS can charge. FMSs can't charge more than this per month. So it's cut into the tiers according to which model you use, and then of course, how many services. So this would be flat out, you would be able to create a spending plan knowing how much you're gonna need a year for your FMS just by using this chart, basically. And I did have an example of a client, of an individual. I know that this is part of your orientation probably, so you might have already seen this. So Jason, he's 26 years old. You know, he lives at home with mom and dad. His sister's non-California, so he doesn't have a lot of extended family nearby. He goes to a day program during the weekdays where he loves to garden. He loves music and singing. He doesn't have a lot of friends, so he stays home at work. He has autism and some health issues. He's pre-diabetic. And then I listed some of Jason's people in Jason's life, some of his supports. And what happened was with Jason, we did our person-centered plan, of course, because we want to start with person-centeredness. And then from that, we created goals that went into the IPP. He wants to find a job. He wants to move into his own apartment. He wants to make new friends. He wants to pursue his love of music, and he wants to be healthier. So with that, Jason then created, or Regional Center created the individual budget for Jason, which is what will be the next step once you have your person-centered plan. Regional Center could be developing the budget while that's happening. So the budget is actually an accumulation of all the money that has been spent on Jason in the last 12 months by the Regional Center. That's going to be a combination of the IPP, looking at what resources and programs and were actually allocated for Jason, and then the actual cost, what was actually spent throughout the year. Because as we know, sometimes there are things on your IPP that maybe we couldn't find a care provider, maybe the program was full, so you weren't able to utilize that service. So it's always important to be looking at the IPP and the annual cost statement. And then once that happens, the Regional Center is going to give you an individual budget, which is just going to be a total of a year's worth of service. So for Jason, it was the $63,100. So Jason took that. He took his goals that he had established from a person-centered plan, looked at his generic resources. Obviously, again, this is still a federally funded, Regional Center funded program. So you need to utilize generic resources. Looked at the cost that it was going to take, did some research, did the math, and created a spending plan where he was actually able to create a robust program under his budget. This is usually the case when it comes to self-determination, as we've seen from the pilot, that it's usually the budget comes in right about, or the spending plan comes about right about where the budget was allotted or under, because you're able to, there's some cost saving that happens in self-determination. And that is because we have, we're no longer dealing with the middleman, the cost of the vendors of all the programs and services. So if you're familiar with the way Regional Center services are paid for, any vendor receives a rate from the Regional Center, then that rate is used to pay for the programs, their employees, the direct service provider. So then say you're getting $30 from the Regional Center to provide a service, that care provider that's actually providing the direct care might only be getting paid $16 per hour. So that differentiation between the 30 and 16 is what goes into the administrative cost of the program, the overall overhead and whatnot. So that all that $30 comes to you now finally. So you're able to use that money then to supplement, one, paying for an FMS, because that's a cost that wasn't there before in traditional services, and two, paying individuals more actually, or moving a little bit of the money around depending on what your program looks like and the different services that you want to allocate to make sure that you're getting the most out of what your program is supposed to look like, and of course meeting those goals that we lined out. So I did also want to give you a list of the actual service budget categories for self-determination. This is available on the DDS website. But just to give you an idea of this is what's used to create your spending plan, you're going to have a service code allocated to each of the individual services in the program that you develop. And so that is how they're paid out. There's also definitions for all of these services on DDS as well. They are fairly vague, and that was done on purpose so that you can be, we can kind of put services into certain plans, develop very personalized solutions, and be able to allocate them into a specific category. And that's why DDS made those somewhat broad, so that we could be adventurous and actually, create a program that really fits to what the goals are supposed to be. And so I did also want to give you a picture of what his spending plan actually looked like when it came out, that $58,804, and showing the different services and kind of how he calculated it out for the year. Also, you could see that he did allocate for a financial management service in his spending plan, and it's still under his budget. And so that's kind of a realization of what a spending plan will look like. Of course, this is kind of a very simple one. It doesn't describe what the services are, but your spending plan will probably actually go into more detail with your FMS on what exactly community living support, what is that? What are we doing there? Which program is being utilized? Which organization? Is there someone who's hired for that? Who is that? Who's getting paid? What is their hourly rate? All that information will be part of an FMS's kind of allocation when it comes to the spending plan as well. And so Jason specifically, his program, he did want to hire his own help, and he also wanted to use an agency for job coaching. So he was utilizing those two models, and this is why I used Jason from the original orientation example, because he decided to go with co-employer in that example. So he didn't want to hire someone and take on full responsibility for being an employer. He wanted to share that responsibility with his FMS, so that is a co-employer model. And so he's allocated himself into the co-employer model for his program. His spending plan, as we saw, had more than 5 services. We go back to the chart, we can see where his monthly payments are going to be $165 max. So we allocated the 165 times 12, which was the 1980 that we saw on his original spending plan. And just a couple things to think about when thinking about your FMS. Make sure that you're keeping your FMS in the loop as soon as possible. Ask questions, interview your FMSs, ask about fees, resources, their professional experience, their payment options is also a good question. Can you pay by card? Can you pay by check? Can you pay invoice? Those are all good questions to ask your FMS. And again, involving that FMS as soon as possible, making sure they see your spending plan before it is officially signed off, in case there are any discrepancies or any questions that the FMS might have, to make sure that they can pay accordingly. Also making sure that you complete the necessary enrollment forms. We do have to do a DDS background check, which is done through DDS, so it is not under the FMS's control. So we want to get that started as soon as possible. If that requires, again, those DDS background checks are when you're hiring someone. So in the co-employer model, you are hiring someone. So that's where we bring the DDS background checks to light. Also, the FMS is going to verify that all your HCBS compliance assessments for the program have been approved by the client, family, and the regional center. So that's the other thing about self-determination, is that all services have to be compliant with home and community-based services. Right now, there isn't an actual assessment tool that DDS has released, but for now, we are just going off of the client family certifying that it is HCBS compliant, and the regional center approving that it is HCBS compliant as well. And then again, ensuring that the open communication happens between all parties. This is different than traditional services in the sense that there is more freedom, there is more choice, there is more responsibility. So just remembering that keeping all parties in the loop is what's going to help to transition you into the program faster and more smoothly. We don't want to have any kind of lapse in services or any loss of budget funds, as John kind of touched on as well. And then when you're hiring someone, so if you're using the sole employer or the co-employer model, remember to factor in your employer burden. So when you hire someone, it costs more than just their hourly wage. There is that workers' comp fee, there's insurances. So it might be, on top of that when no one's getting paid $10 an hour nowadays, but say it's $10 an hour, there's a 13%, overhead. So making sure that you account for that $1.30. So it would be it's $11.30 to actually employ that person, because that covers the workers' comp and the insurances and whatnot. So when you're actually creating your spending plan, remembering to allocate for those additional employer burden costs, and your FMS can help with that as well. And each FMS is going to have their own unique employer burden percentage. So that's a good question to ask as well, because the lower your employer burden, the more money you're saving when you're employing people as well. So always remember to take that into consideration when thinking about your FMS and creating your spending plan. And that is it for the actual co-employer model that I have. I will stop sharing.
Great, thanks, Joe. I
Lots of
appreciate
information.
that. It is lots of information. I appreciate you putting it all in a short amount of time. Okay, so we'll have Jason talk a little bit about sole employer. Jason's from Mainsole, and he can kind of share with us, and then we'll follow up with some questions. There, real quick, Joe, just because I have you on here, there's a question. Can we get access to the PowerPoint that you just shared?
Yes, I can actually just give it to you, Tracy, and you can distribute it to the people that attended, if you would like.
Okay. Okay. Yeah, myself and Herman, that would be great.
Great.
Okay, so we'll go ahead and move forward with Jason, if you want to go ahead and present on sole employer.
Yes, I sure will. I also just have one quick slide to share about sole employer, if I can get access to share too. Yeah, my name is Jason Berquist. I am the Director of Participant Directed Services at Mainsole. And I'm here to talk about sole employer for you. Like the others have said, let me share that, and then you can see what I'm doing here. Okay, so this explains a little bit about sole employer. It is the other employment model that involves you hiring employees. So as John talked about the bill payer model, there's no employee relationship with the employees. They're all employed by an agency or some other company or independent businesses. And then as Joe talked about co-employer, you're co-employing the workers along with the FMS provider. And in sole employer, as the name implies, you are the employer, or someone in your household is the employer of the workers. And the FMS really just acts as your payroll agent and still processes all the payroll for you. So you're not responsible for that, but you are still the legal employer of your employees, and this helps you set that up. We set you up as a legal employer with both the IRS, the federal government, and with the state. And then we pay the employees, process any employment taxes that are part of that, and then make sure those are all filed on your behalf as well. So I really just wanted to talk about the differences between sole employer and co-employer, because I think Joe talked plenty about what the employment models mean, but I think just the questions always come in, why would I choose one over the other, or what's the difference? Generally, the difference between the two is that in the sole employer model, it gives the person the most control because you're not co-employing with an agency. Your employees aren't subject to the policies of the FMS provider. So as a co-employer, we might have a policy that we have certain requirements if an employee is going to be driving, or we have certain training they might have to attend. It would depend on the FMS, and that's something you'd want to ask. But under sole employer, because we're not the employer in any way, we don't determine what the requirements are for your employees. However, there still are things that need to be done, and that's policy of the self-determination program. For instance, if someone's providing personal care, they still need to have a background check, and we would still do that for you with the life scan process. But they wouldn't be subject to our policies. The other difference, as Joe mentioned too, is the employer burden. Each FMS is going to have a different tax percentage rate for that employer burden. And that also might be different between the co-employer model and the sole employer model if an FMS does both. It could be more, it could be less. It's usually less. And so that's been attractive to some people, that the employer burden's a little less in the sole employer model, but that's not always the case. So you'd want to ask that. And then one of the other things that comes up too is the workers' comp and the other insurances, as Joe mentioned. As a sole employer, you're responsible for insurances, especially workers' comp, which is the one that comes up a lot. In our case, as an FMS, we take care of that for you. We have brokered a policy that we can do that for you. That's not the case for all FMSs. And so that's something you definitely want to ask if you are thinking about the sole employer model, is asking, can they help you obtain that workers' comp and other insurances? Do you need to do that on your own? Do they have any resources to help you if you do have to do it on your own? That's an important factor, I think. But if you're looking for that more control, that's probably the model you want to go to, so your employees aren't subject to an FMS's policies necessarily. Something else to think about too is if you're thinking about like health insurance for an employee under an FMS model of co-employer, your employees may be eligible for insurance through the FMS if they qualify for that FMS's policy. Under sole employer, again, because they're not employed by the FMS, they wouldn't be eligible for an FMS's insurance policy. And you may, be able to help them other ways or help reimburse their cost of their insurance, but they wouldn't be eligible for just a policy that's already right there for health insurance. So that's something to think about as well. Otherwise, the other things still apply if you choose sole employer, but also have companies and vendors to pay. Bill payer is built into the sole employer model. So on top of paying your employees, if you also have other bills that need to be paid or other items that need to be purchased, bill payer is included, as well as those monthly reports that both John and Joe talked about. We send a monthly report every month that shows what's been paid out, what's left, so you can plan ahead, know where you're at throughout the year, and that goes both to program participants as well as the regional center service coordinator to make sure everyone's on the same page and knows what's going on. And the fee schedule, as Joe shared on his slide too, the fee schedule is set by DDS as the maximum rates, and it is based on the number of services provided. And then the fees are a little different between sole employer and co-employer, at least the maximums. Again, you'll want to ask your FMS what their rate that they're actually charging is. So I think with that, I will stop there. I think most of it is already covered, and then hopefully, I'm sure people have questions for us.
Thank you, Jason. I appreciate that. Yeah, so I think we'll kind of open the floor for questions. I don't know if there's any in the chat, but we definitely want to, if people have specific questions, we can ask now. I know having Jason, John, and Joe here is a great opportunity for us to be able to have the FMS directly answer questions. So just open the floor. If anybody wants to unmute themselves and ask, now would be the time.
Hi, I'm Tammy Bradley, and I have a question. I'm actually kind of interested in the sole model, but I wanted to know, as far as are all FMSs doing the features that Maine Zell does, as far as you had indicated that you do some of the legwork to get things going. You offer possibly helping with insurance and those kinds of things. Is there any sort of list to know which of the FMSs are all doing that, or how is that available?
I don't believe there's a list of which FMSs are willing to help as much as others. I think you'd have to ask each FMS those questions. Okay. All FMSs aren't offering all three models either. So not all are offering sole employer as an option, and some don't offer co-employer as an option as well. I think most that are offering sole employer will help you with those things, because it's a common question, and but
it's very complicated too.
Right, exactly. But they will also all help in different ways. So you definitely want to ask if they're willing to help you, but also how they're willing to help you. We have, like, for the workers' comp, we already have a policy, like we have it. So there's not much legwork at all for you, but others might just give you resources to help you find it. So it depends on what you're looking for. Okay. Yeah.
And then I kind of had a question real quick for Joseph also. You had mentioned that with the co-employer, that it is kind of a shared responsibility between the FMS and the participant. So in that it's shared, what part of the participant responsibility would I be in? So you do pretty much everything. And then would I hire my own people, or how does that work?
Sorry, had a problem with the unmute button.
Oh, sure.
Yeah, so that is basically, you kind of did hit it, Tammy. It's that you are the sole person deciding who you hire, training, when they work, and also if you decided to let them go, you would be the one to decide that you want to let them go. Like the example where a policy would be in place under the co-employer model would be, hey, give us 72 hours notice if you're going to fire someone. That's a policy that we'll put in place so that we make sure that you legally end that relationship according to employment law. And so that's an example of a policy that we would have in place as a co-employer FMS. But yeah, sorry, go ahead.
Yeah, I was thinking like then I would be kind of like a supervisor. In my mind, I'm trying to kind of come up with the hierarchy to where I can understand it. So you guys would be the company, so to speak, and then I would be the supervisor of my staff. Is that kind of a good way to look at it?
Yes, pretty much so. And again, you're still going to have all that control under the sole employer as well, but the co-employers, when we put in these little policies just to make sure that we're in adherence with employment law.
Right. And that's what I definitely don't want to, I don't want to mess that part up either. So I'm kind of toying between the two. Thank you both very much. Appreciate that.
I just want to add something too, because just when Joe brought that up, a policy of 72 hours, let's say, to let us know. Even in the sole employer model, we probably want to know a little bit in advance too, because we want to help you comply with employment law by making sure we pay an employee as soon as you let them go as well. So although we can't enforce that policy, we want to make sure we're helping you follow the complicated labor laws and make sure we're paying an employee right away if you're going to let them go. But we give you guidance on those things so that you know what's going on and what your responsibilities are.
Okay, perfect. Thank you.
Tammy, what a lot of times what happens is that you was mentioned earlier, but what happens sometimes you choose the bill payer model and the co-employer model. So it doesn't have to be a single thing. It could be a combination because you may have bills to pay, say for voice lessons. That would be a bill payer type of item. Yet you have an employee, that would be a co-employer item. So you could kind of mix and match what was referred to earlier by Joseph. We're vetted for all three models also. And what's important is that it has to be custom designed for you. This is your program. And so that's the beauty of what everyone's talking about. It's you. But a lot of times it's mix and match, bill payer and co-employer.
Okay, so you don't have to have just one. You can have kind of a combination. That's
Yes.
where I was. Okay, I'm glad you
Yes.
said that because I thought you had to choose one.
No.
And here I'm going, oh my
No.
gosh, because I have I have transportation needs that are going to be one
Right,
area.
exactly.
Yeah, and so I'm like, how does that work? Okay.
Yep, no.
Tammy,
Yeah, it's important to know because it's an individual program customized for you. And what each of us are speaking to are just one component, the bill payer, co-employer, or sole employer model, but they can be mixed and matched.
So I would probably be more interested in one that would then do several areas in my decision making. Then that's what it sounds like.
And I'll chime in here too, Tammy, is that you are going to have to choose one when it comes to sole employer versus co-employer. You cannot do a sole employer model and a co-employer model.
Yes.
You can only choose, when it comes to the employment function, you can only choose one model. So that's where that decision comes in. But
only related to my staff, is that what you're saying?
Yeah.
Like I have caregivers. Okay.
Yeah, if you're going to employ anyone, if you need to use the co-employer or the employment function for the FMS, then you need to decide whether you're going to go a sole employer route or a co-employer route, because you can't use both models in self-determination because they're both an employment model, basically. So you would only need one. And then we're always going to be doing the bill payer function either way. If you go sole employer, we'll be able to do bill employer.
Oh, gotcha. Okay.
If you do co-employer, we'll be able to do bill payer function. Aviana only does co-employer and bill payer functions. We don't do a sole employer model, but again, that's why it's important to ask your FMS or shop around kind of. And DDS does list the FMSs and the models that they do provide on their website. So that at least is out there in public where you can find easily, but just something to know as well.
And one more thing, as far as the location, I've learned recently that an FMS can go outside of a catchment area. Like Alta has a particular catchment area, but if you're based in San Diego, I think one of you were, then are you outreaching to the Northern California, or does anybody know that one?
I'll breach that. Yes.
Okay.
The FMSs, most FMSs can reach vast areas pretty much statewide, honestly. A lot of the functionality of the FMS can be done remotely via Zoom. Now we're seeing all of these other email, phone, all of that stuff is being utilized to make sure the relationship between the client and the FMS is strong and where it needs to be. So we actually work with all 21 regional centers and cover all catchment areas. And most FMSs are headed that route if they're not already, honestly. And there's the ability to courtesy vendor, once you already have been vendored with a regional center to do the FMS function, these FMS models, then you can easily move into the next regional center if that's needed and whatnot for the client, because it is supposed to be the client's choice. The client is supposed to choose. So even if you chose an FMS, maybe that wasn't a vendored of that regional center as of right then, you could get them vendored by that regional center then if you so wanted them to, because you're choosing your FMS technically.
Perfect. Thank you so much.
Tammy, yeah, we're a vendor at Alta also. So
okay.
we're vendored in all 21 regional centers. So what Joseph's talking about is that the catchment area is important, but the most important thing is to be vendored by the regional center. So we can reach out to San Francisco or Sacramento or wherever, the same as other people. And that's an important feature, I think, for everybody.
Yeah. What was the name of your company, John, again? You're on mute, sorry.
The Emlyn Group?
Emlyn.
Am I getting through? No.
Yes.
Okay. Yeah, the Emlyn Group.
And just like Joe referenced, that there is on the DDS website the list of FMS agencies, and you can even see which ones are vendored with each regional center as well at the current moment. So thank you, Tammy, for that. Okay, couple questions in the chat. First one, how involved is the FMS in the person-centered planning? It's a good question. Joe, you want to take that one?
Sure, I can chime in. There is no requirement, or I mean, it's up, obviously it's up to the client. If obviously they have decided who their FMS is and they want to involve them in their person-centered plan process, they can. It's not a requirement for them to be part of the person-centered plan, because of course that is focused around the client themselves and what their program wants to, what are their dreams, what are their aspirations. Let's create that plan, and then let's take that plan and then create a spending plan, which the FMS will use. So there might be, you would definitely probably want to involve your FMS once you're doing that transition from person-centered plan to spending plan, to be able to interpret kind of what those services were and what they look like and how you can utilize those categories that I showed to create this program. But yeah, there's not necessarily any need for the FMS to be involved in the person-centered planning part. But again, this program is all about choice and who you want to be in the room when those things are happening. So if you wanted them to be there, you could always ask them to.
Great, thank you. And there's another one here. When using a combination of the services, are the fees itemized out monthly, or will it be included in the highest rate available?
I can take a stab at it. I think you're asking if you're using one of the employment models as well as bill payer, are you paying double the fee or is it separated out? I think that's what the question's asking. There will be one fee per month from the FMS, and it would be at the higher of the two, which would be the employment model fee that includes the bill payer function in it. And that's based on what you've written in your plan, based on how many services are in your plan. And so it's just a flat fee every month, and it would be the same every month. It wouldn't change based on how many services you use that month. It's what you plan for in your spending plan. And it would, if you have employment in either co-employer or sole employer, it would be the fee for that model that would be used.
And I will piggyback on that too, because I've actually had this question in a different way, in the sense that they asked, say they have a program that they're only doing during the summer. So that's an extra service all of a sudden just for part of the year. So that might be the difference between that 4 services in their plan and 5 services in their plan, which is that difference of an extra how many dollars a month. I've had families and clients ask, will you charge extra a higher fee for those 2 months or whatnot? That's all going to be determined. Yeah, it's going to be, you're going to have a conversation with your FMS, and that's going to be determined on how they want to approach it. Usually, yeah, we're going to absorb it. We're not going to charge that extra, but depending on what the actual plan overall looks like for the year, maybe it's like, hey, you have another service where you're going to be down a couple of months. So we're not going to we're not going to charge you that part of the year, but this part of the year, we're going to charge it just kind of to assume that there would be 1 full year of service, maybe, you know, if we added those 2 together, kind of thing, that would add 1. So it's going to be a conversation that you're going to have with your FMS. We are definitely we work with our families, and we have usually overlooked that, you know, couple of months.
Great, thank you. Another question here. Do your FMS agencies also offer independent facilitation services? John, I'll throw that one at you to start. Uh-oh, you're on mute still, John. Sorry. Technology. There you go. There you go.
There we go. No, in the case of the Emlyn Group, we do not offer independent facilitation services, but we know a number of people from a number of different agencies and individuals, and so we can refer people, and then the participant can choose who they would like. But it's not part of our offering. It's simply FMS. But we know enough people that there's somebody out there that can help you.
And Joe and John, you or Jason, you can speak to that too for your agency specifically.
Sure, yeah. Kind of also what John said, we do have actually resources that we can refer out, kind of where you would find your IF. We, of course, don't want to be pushing families towards one IF or another. We want this, again, the freedom of choice, but we can definitely give them the resources to find the IF. There's large support groups right now that have been developed in California that are just IF networks at this point. One thing that Aviana is doing too now is we do actually have all of our SDP staff is trained in person-centered planning. So actually we could help with person-centered planning if that was a family need, or we actually do have a network where we can contract out PCPs as well. And that would actually be part of transition services that we provide, which is the transition service from traditional services to SDP. So there's that, you know, helping to create that piece of person-centered plan, helping find that IF, helping transition smoothly into SDP as well too. So those are options that Aviana provides as well.
And we also don't offer independent facilitator services right now. We actually do person-centered planning, and we've been training people to do person-centered planning, but we're not doing independent facilitator at this time, no.
Thank you. Is there, I see there's a link to the DDS FMS list in the chat. I don't know if y'all saw that. And then also An independent facilitator cannot be someone who is providing other services to the participant pursuant to their IPP or be employed by another person to provide services to the participant. So just wanted to clarify that. Any other questions? I don't see any more in the chat. Go ahead, Herman.
Great.
Sorry.
Tracy, Carmen had her hand raised and was
Oh,
waiting
I'm
for
sorry.
the time, but we didn't have a break in flow of questions.
Yeah,
Carmen,
my pictures were a little across the top. Sorry,
Right.
Carmen.
No
right.
problem.
I caught a pop-up in my icons, and Carmen posed a question in the chat. Are you comfortable with that being shared, Carmen?
Yes, not a problem. I hope
Appreciate
that's
it.
clear, though.
I think I understand what you're asking, and if not, I can ask you to clarify. But with the several models and agencies, what coordination is there between Alta's fiscal department, our POS and billing, and the various FMS agencies to prevent a lapse of service and non-payment of providers? So once Alta approves a spending plan and authorizes an FMS to make payment on those identified services in the participant's plan, the FMS is aware of what the overall budget is and ultimately takes responsibility for paying those providers. The monthly report that would be issued that would share what's been spent, what's left, I believe would be the mechanism to verify and ensure payment, as well as track to ensure that you're not on pace to outspend your budget for the year, if I'm not mistaken. And the three FMS vendors can correct me if I'm wrong. And one other question I wanted to pose, because it was something that wasn't necessarily intuitive for me, and I think I heard this, that it may be one of the FMS agencies that's here today, but, and I appreciate you sharing that not every FMS agency offers every model of service. So depending on what the constellation of services a participant is looking to access, that may narrow the options. Additionally, I thought there was one FMS agency that was unable to pay for any type of contracted nursing services because they also had a competing contract delivering nursing services. And I'm not sure if that's something that is exclusive to nursing, or if there are other service categories that, due to conflicts, even though a model might exist, there might be restrictions on what types of services an FMS agency would be able to support a participant in accessing. And I see John shaking his head yes, but I'll open that up to see if there's a response that can be shared. Thank you.
I'm agreeing with you. I'm
All
agreeing
right.
with you. Yeah, usually there's a statement of a conflict of interest that's signed, and that eliminates exactly that issue. But yes, if you're providing, as I said earlier, an independent facilitator with someone who's providing other services pursuant to their IPP, or to be employed by another person to provide services to the participant. So you've got to be careful what you're doing when you sign up. And I think that's an important point. Maybe overlooked sometime, but yeah, you don't want to get yourself in a you don't want to be kind of a conflict of interest. That's not a good thing.
I can add in on the nursing. We do have people that have hired nurses, and we only allow that under the sole employer model, not under the co-employer model. So that may be something that you were referring to there, because under the co-employment model, again, we'd be co-employing that nurse, and we wouldn't want to co-employ a nurse. We're not a nursing agency, but you could sole employ a nurse as well. So that's something that's happening currently. So again, there's things like that you might want to talk to your agency about and see if they're willing to employ the type of worker you're looking for. As Joe said, it's important to just involve your FMS as soon as possible in your spending plan as you're thinking about it, because then those things won't pop up later and surprise you that suddenly you can't do something in the model you've chosen or not in the way you chose, and then things have to be reworked.
Thank you, James.
Herman, can I go back and ask a question? This is Carmen. I'm sorry. On my last question about the coordination and communication between the FMSs and the fiscal, or maybe it's the Alta coordinator, and maybe it's all three sections. So what I heard you saying is that the Alta fiscal team will make the first touch to the FMS so that everything gets rolling, the e-billing and the POS.
Well, to give you a more behind the scenes look, the service coordinator initiates the purchase authorization request that goes to our accounting department that gets authorized, and then the FMS receives confirmation of that via an authorization. And I'm not sure if the terminology is considered an invoice, a turnaround invoice, e-billing, but there's certainly communication at that point that's transparent between Alta's accounting and the FMS agency as to the funds that are available and what they're designated, specified for. And that would also be something that would be transparent. And I'm not sure if it's automatically communicated to the client, but it seems like it would be kind of incorporated into the report of the budget and allocation that's sent monthly.
Okay, thank you.
Yeah.
No other questions that anyone has? Herman, do you have any more in your?
There's a great question in the chat about the IF. Could it be an IHSS worker, given that that's someone who's being paid, but not out of regional center POS dollars? And I remember that question came up when we were doing these trainings live, and I put it in the parking lot and actually found an answer, but I haven't committed to memory. Does anyone know if the IHSS worker can act as the independent facilitator?
I want to say I believe so.
I think that's where we landed. I understand the question was asked privately, but I think it's a great question and one that could impact others. So I did want to share and also ask if anybody else had confirmation on that. I'll look back into that and connect with the person who asked. And then we've got another chat. How long does it typically take to get the FMS set up and the coordination going? Is an independent facilitator required? I'll answer the second question first. Is an independent facilitator required? No, that's an optional service. It is unique to the self-determination program. One of the differences between traditional service delivery, but you can proceed without that role being designated. And the length of time, we do have people who have successfully navigated the program as pioneers. So hopefully things will run more smoothly, but Carmen might even be able to give us some insight on that. But I would also say that the length of time could depend on how many FMSs you're interviewing, how many questions you have. Do you have an idea already in mind of the model that you're going to be seeking when you put your spending plan together that will help narrow that focus so you know exactly what you're looking for? And it could happen within a matter of days, if you're just looking for a simple bill payer and you know exactly what you want to purchase, and your questions are pretty straightforward because you're just looking for somebody to cut checks consistently. If you're getting into the complexities of that employer-employee relationship, your questions and interview and feeling out which FMS is the right fit could be more time consuming. You may get information from one that you want to circle back and then verify with others. So it kind of puts the participant in the driver's seat to some extent on that.
Yeah, and to speak to that a little bit, we're also working with our service coordinators to kind of share with them that what their role is as far as sharing resources with the participant on, the FMS agencies, how to interview and select, and sharing any training material and resources so that, the participant is well informed when they're trying to select the FMS agencies. And then, like Herman spoke to, the timelines are not rigid. It's really difficult to make very specific timelines. I mean, we kind of make suggestions based on experiences with other participants who've gone through the process on what are suggested timelines, but there are some areas of the SDP process that really are dependent on how quickly the participant has accessed some of these services. So, and that's kind of one of them with the FMS agency. Any other questions you're seeing, Herman? Sorry,
I'm not seeing
Tracy,
anything else in chat. I was looking to see if I could find my notes on the answer, because there are others who have expressed interest in the answer as to whether or not the IHSS worker could be the independent facilitator.
Okay.
But I've got folks' email addresses. I think the promise or the request of, well, let me put this out there quickly as well. I think Joe's PowerPoint presentation might have been excerpts, if I'm not mistaken, from the larger, maybe 60 slide PowerPoint presentation that the department put together. And if folks are interested, I could send that. That would be inclusive of not just Joe's not just the co-employer model of FMS that Joe covered, but also the bill payer, also the sole employer, and also every other PowerPoint slide that was associated with the training. It'd require more filtering to get to the portion that Joe specifically presented on, but it would be more comprehensive, more inclusive. So folks want that. I've got everybody's email contacts, and I can send that 61 slide PowerPoint presentation out to the group. Hopefully along with an answer to whether or not an IHSS worker can be an independent facilitator before the end of the day.
Herman, there's one more question in the chat.
Thank you.
I think there's one other question from Valerie.
Yes, thank you.
Is there the ability to have? Do you see that question from Valerie?
I do. I'll go ahead and read it aloud so folks can hear, and it'll make it to the recording. Is there the ability to have some overlap between getting an FMS set up and employee background checks completed versus the services currently being used? So overlap, what we commit to is seamless continuity of care, where there wouldn't be a disruption of the traditional service delivery until the services in the FMS or the SDP model were all set up and ready to go. I believe that's the commitment. That said, I'm wondering, do the FMS agencies initiate the background checks in advance of the payment, the authorization? Thanks, John.
Yes. Yep.
And nobody asked the question, so I guess we're all considering employing staff or providers or accessing services that would be delivered by people without any sort of criminal history, which would be good, but sometimes people find themselves in trouble. No one asked the question, what happens if there is a provider who does have a blemish on their criminal background? If it's a minor crime, the department can approve that individual to still deliver services. If it's a more serious offense, certainly anything that would be a violent crime, anything of that nature, they aren't going to be able to be paid to deliver services and support participants out of the SDP program. Just thought I'd throw that in there since background checks were brought up.
Thank you. And I know we've kind of gone a little over. I appreciate all of you that were able to stay a little later. Anything else, Herman, that you're seeing?
Nothing in the group chat. So just catching up on some communications and wanting to be mindful of confidentiality and privacy. So
Right. And thank you, Valerie. She just wrote, this was awesome. Thank you. That's very nice of you. You know, our goal is to just keep sharing information and answering questions. So, and thank you to John, Joe, and Jason, the J group that we had today from the FMS agencies. I appreciate you all three for coming on and sharing the information and being available to answer questions.
Tracy, can I add that we do have another one of these scheduled for May 11th. That is FMS also. So if you think of questions you did not ask today, you'll have another opportunity if you'd like to participate then. And there'll be other participants. And so you might hear other answers that you hadn't thought of as well. So if you'd like to participate, there's that option also.
Thanks, Rebecca. I appreciate that.
yeah, and we've got these sessions scheduled out until June 22nd, this being the 4th of 8. And we don't have any topics identified after June 22nd. That doesn't mean we wouldn't intend to continue these type of interactions and connections with the community if there was still value in it. So if you have ideas, requests, suggestions for other topics of interest, please feel free to send me an email, reach out to your service coordinator, ask questions.